How do genetic factors affect stopping bipolar medication? Imagine trying to solve a puzzle where some pieces are hidden or look different for each person. That's similar to how genetics influence whether stopping bipolar medication is safe or risky. Bipolar disorder is a complex condition shaped by both genes and life experiences. When it comes to stopping medication, genetics can play a role in how your body responds and how likely you are to experience a relapse. Research shows that some people have genetic variations that affect how they respond to mood stabilizers like lithium. For example, certain gene differences, such as those in the brain-derived neurotrophic factor gene, have been linked to better or worse responses to lithium. If someone has a family history of good response to lithium, they might be more likely to benefit from continuing it. But genetics are just one piece of the puzzle. Many other factors, like personal treatment history and current stability, also matter. When someone stops bipolar medication, especially after being stable for a while, there's a significant chance of relapse. Studies suggest that within 1 year of stopping medication, about 37% of people might experience a mood episode again. This risk can go up to 60% within 2 years. Genetics may influence this risk. For example, some individuals with specific genetic backgrounds might be more prone to rapid relapse or treatment resistance after stopping. Their genes can affect how their illness naturally progresses, making relapse more likely or severe if medication is discontinued. It's important to remember that most research doesn't focus solely on genetics. Instead, it looks at a mix of personal history, how well the medication worked before, and the overall course of the illness. Genetic testing isn't yet a routine part of deciding whether to stop medication, but scientists are working on identifying biological markers that could help personalize these decisions in the future. From a practical standpoint, stopping bipolar medication should never be done without professional guidance. Even if your genetics suggest you might do well without medication, the risk of relapse remains high. A gradual tapering process, supervised by your healthcare provider, is usually safest. This helps prevent sudden symptom return and reduces the chance of developing treatment resistance. Genetics can also influence how you experience side effects or how your body interacts with other medications, which might influence your decision to stop. For example, if you have a genetic predisposition to certain side effects, you might be tempted to stop medication, but this could increase your risk of relapse. Balancing these factors is key. Ultimately, deciding to stop bipolar medication involves weighing the potential benefits, like fewer side effects or simpler treatment, against the risks of relapse and illness worsening. Genetic information can provide some clues, but it doesn't give a definitive answer. The best approach is a personalized plan created with your healthcare team, considering your history, symptoms, and response to treatment. Looking ahead, ongoing research aims to find ways to use genetics to make smarter, more tailored decisions about medication management. For now, if you're thinking about stopping your medication, it's essential to work closely with your doctor. Regular check-ins and a clear plan for quick intervention if symptoms return are vital for safety. Remember, genetics influence how bipolar disorder behaves and how you might respond to stopping medication, but they are just one part of a much bigger picture. Always seek professional advice to make the safest choice for your mental health.